Dr. Vickers graduated from the University of Toronto, the National College of Naturopathic Medicine, and the Oregon College of Oriental Medicine.
Very good. So I'm going to talk about lupus and just some simple things that you can do. We hear that with the medicines there are a lot of side effects. So things that you can do to counteract the side effects that are safe, accessible, and hopefully effective. So I'm going to basically talk about 5 different things. Acupuncture. Okay. Another thing that's interesting, acupuncture. So I've been an acupuncturist for 28 years now, and I think it's fabulous for pain. A lot of people, I see people before they're diagnosed with lupus. They come in because they think they have fibromyalgia, or they think they have chronic sore throats, mouth sores. They have a rash. It's not quite a malar rash, but it comes and goes. They have a lot of fatigue. They're not sleeping. They have digestive problems. They have a tendency to get pneumonia or tendency to get pleurisy. They have chest pain. And so one of the things that, well, we're trying to do blood tests and do a workup, one of the things that can help alleviate symptoms. Acupuncture isn't a cure, but it's a great modality to help to alleviate symptoms and provide some relief. It is a needle. The needles are very thin. They're hair thin. I brought some with me if anyone's interested to see what they look like. It's not, I think when you have a chronic illness, you've had a lot of blood draws and you've had a lot of exposures to needles. And so when I say it's the application of needles in many different places in your body, people think, I don't want another needle. But I would try to think of it as a fine hair inserted just very minutely into the skin to stimulate and cause an anti-inflammatory relaxation effect. So acupuncture's been around for a long time, 4,000 years. We're very lucky in Portland, Oregon. There's actually 2 colleges of acupuncture medicine, Chinese medicine here in Portland, Oregon. There's the Oriental College of Oriental Medicine here. It's actually right next door, right there, right a few blocks down there, and that's been around since 83. I was in their first graduating class. And then NCNM, where I teach now, which is the National College of Natural Medicine, they have a program, classical Chinese medical program that's been around for 12 years, I believe, and I teach there now. So you have 2 programs, which is great. So there are a lot of acupuncturists around, and there are a lot of clinics that offer low-cost treatment. So there's a lot of accessibility. It's recognized by the FDA. There really are no side effects. You might get a bruise from where the needle's inserted, but really there are no side effects. Most people benefit by having increased energy, better sleep, better digestion, less pain, less inflammation. So I think it's worth looking at and at least trying. So there's a clinic called the IEP clinic, the Immune Enhancement Project, which was started 23 years ago, and it's a nonprofit clinic that offers acupuncture and Chinese medicine for chronic disease. And they've been looking at lupus over the last 10 years or so, and they've started, just in the last 6 months, they've started offering treatment for people with lupus. So it's a great idea. There's a handout over on the table by Molly's picture over on that table there by Subhuti Dharmananda that talks about what the program is. And it's a very low cost, free, if you qualify for free, to go and try Chinese medicine if you choose to do that. So I know that both schools have clinics where they offer low cost clinics, so it's really accessible in Portland, Oregon. So I think I talked mostly about what is acupuncture. So this is one of my patients who I was treating, was undergoing chemotherapy, and I was treating acupuncture for side effects of chemotherapy, mainly nausea in her ear. So the needles, you place the needles, as you can see, there's 5 little needles in her ear, and they're left in for 15 to 20 minutes. Each of the needles are disposable and sterile. They're left in, yes, as I said, for 15 to 20 minutes and then taken out and discarded. And patients generally feel relaxed. A lot of people fall asleep on the table. So, I mean, it seems odd that you would have needles in your body and fall asleep, but that really is the common reaction. Thank you.